It's well recognized that there are two common acute adverse events, the cytokine release syndrome or CRS and neurological toxicity, which is now also referred to as ICANS or immune effector cell associated neurotoxicity syndrome. Um, what has helped in terms of assessment of this neurological toxicity is development of a consensus grading system by the American Society of Transplantation and Cellular Therapy, which is now referred to as the ASTCT consensus grading system for both CRS and ICANS. In some of the earliest studies, different grading systems were used by different institutions as well as on different trials. So it was very difficult to compare toxicity profiles of the different products and across different trials. But with the development of this consensus grading system, which is now used at most hospitals across the world, there is consistency in the grading of CRS and ICANS, and which allows comparison of toxicity data across different products and trials. In terms of the management of these toxicities, I think the use of tocilizumab, especially at earlier grades, such as grade 2 CRS, has definitely improved outcomes in patients with CRS and minimized the development of severe CRS. So in some of the early studies, we have seen deaths related to CRS, but that is much less common now. However, for management of neurological toxicity, we still don't have a good strategy. Currently, we generally use corticosteroids for management of grade 2 or higher neurological toxicity for most patients. But based on discoveries from a number of different groups over the last few years, both from preclinical studies as well as correlative studies on clinical trials, we now know we have better understanding of the pathophysiology of neurological toxicity, and that has led to some new clinical trials, such as, for example, the ZUMA-19 study, where we are evaluating lenzulumab, which is an monoclonal antibody against GM-CSF, to mitigate neurological toxicity, since GM-CSF has been identified as one of the key mediators of neurotoxicity. In addition, a number of groups are also evaluating anakinra, which is an IL-1 receptor antagonist to target the IL-1 pathway, which has also been identified as a key player in the pathophysiology of neurological toxicity. So those trials are ongoing currently, and early results are expected sometime in the next 1 year.